Hi friends, welcome to Physiodemic. Today I will tell you about the thoracic outlet syndrome. The thoracic outlet syndrome describes compressions of the neurovascular structures as they exit through the thoracic outlet. The thoracic outlet syndrome is marked by anterior scalene anteriorly, middle scalene posteriorly, and the first rib inferiorly. So it has two main categories. One is the vascular form and the other is the neurovascular form. Now I'll tell you about the etiology. Thoracic outlet syndrome affects approximately 8% of the populations and a higher prevalence rate in women because of drooping shoulders, less developed muscles, narrowed thoracic outlet. The mean age of the people affected is 30 to 40 age of 30 to 40 years. And there are several factors which can cause thoracic outlet syndrome. First is congenital factors, and the reasons are cervical ribs, fibrous muscular bands, first ribs, cervicodorsal scoliosis, and etc. The second cause is acquired conditions, which includes postural factors, dropped shoulders, trauma, and fractured clavicle. Third is the muscular curve, which includes hypertrophy of the scalene, decreased tones of the middle trapezius levator and rhomboids, and short scalene pectoral and trapezius muscles. Now I will tell you about the clinical features. The clinical feature varies from patient to patient due to the nerve and vessels involvement. So pain in between the neck, occipital region, shoulder, and paresthesia of the upper limb is a major clinical feature. Sometimes patient complain altered and absent sensation, fatigue, and weakness of the upper limbs. So clinical features are worse when the arm is abducted overhead and the head is rotated to the same side. So when the upper plexus is involved, patients complain radiating pain to the ear, interscapular regions, clavicle, and pectoral region. When the lower plexus is involved, the patient complains radiating pain to the anterior and posterior shoulders, ulnar side of the hand. There are four categories of the TOS, and each presents with unique clinical features. These are arteriothoracic outlet syndromes, venous thoracic outlet syndrome, true TOS, and neurogenic TOS. Now I'll tell you about the differential diagnosis of the TOS. There are several other conditions which represent almost same clinical features like TOS, and these are carpal tunnel syndromes, recurrent tenosynovitis, tennis elbow, chronic regional pain syndromes, Raynaud's disease, angina, and malignancy. And other conditions are cervical diseases, herniated disc disease, and brachial plexus trauma. Now I'll tell you about the diagnosis of the TOS, and the diagnosis is based on history, physical examinations, provocation test, and radiological ultrasounds and radiological evaluations. So the TOS diagnosis is usually confirmed by eliminations of the other cases with similar clinical features, and the TOS manifestations are varied, and there is no single definitive test. Now I'll tell you about the special test, and these are Roos test, Addison test, Wright test, and upper limb tension test. So in Roos test, the patient's shoulders is externally rotated, abducted to 90 degree, elbow is flexed to 90 degree. Patient is asked to open and close the hand for 3 minutes, check for radial pulse and symptom reproduced. In Addison test, the patient's head is rotated to the test sides, then patient is asked to extend the head, externally rotate the shoulder, check for the radial pulse and symptoms reproduce. In Wright test, the patient's shoulder is moved to maximal abductions and external rotation, head is rotated to opposite side, Check radial pulse for the tested upper limbs and symptoms reproduced. In upper limb tension test, the arm is placed in different provocative positions and for different knob and check the symptoms reproduce. Now I'll tell you about the medical management. These are non-steroidal anti-inflammatory drugs, botulinum injections to the anterior and middle scalene, and surgical treatment. So the surgical treatment has different approaches. First is the transaxillary approaches, where some portions of the first rib is removed, and the second is the supraclavicular approaches, where the first rib resections and scalenectomy is done. The third is the infraclavicular approaches, and where it is used to treat only the compressed vein. Now I'll tell you about the physiotherapy treatments, and the focus mainly on the pain control, range of motions, nerve gliding, strengthening and stretching exercises. The aim of the initial stage is to decrease the patient's symptoms, and the stage 1 involves the Cyriax release maneuver, where the elbow is flexed to 90 degree, the shoulder is placed in elevated position, head is neutral, and patient is asked and held the positions to produce for the symptoms, and it is around 30 minutes, and patient is asked to do diaphragmatic breathing. The second is the scapula settings and control exercises, and it is to establish the normal scapular muscle recruitments and control in resting position, where the programs begins in lower range of abduction, then gradually progress to the further up until muscles are being recruited. The third is the control the humerus head positions, and it includes the specific drills are given to facilitate the humeral head in control positions. So isometry exercises is given to the rotatory calf muscles in different position. And last is the serratus anterior recruitments and control, and the abduction external rotation strategy to trigger the serratus anterior recruitment is done. This, the second stage of physical therapy includes strengthening exercises of the sternocleidomastoid levators and upper trapezius, stretching exercises of the pectoral levators, trap and scalene, postural re-education exercises, aerobic exercises and home exercise program, DNF activations exercises in standing positions, isometric neck exercises, glenohumeral joint mobilizations in end range elevation and tapping techniques, and first remobilizations exercises. Thanks for watching this video. Stay tuned to this channel Physiodemic for further updates.